All right, we are very excited to be here today with Susan Levin. Susan Levin is the Director of Nutrition Education for the Physicians Committee of Responsible Medicine, a Washington, D.C. based nonprofit organization that's dedicated to promoting preventative medicine, better nutrition, and higher standards in medical research. Susan researches and writes about the connection between plant-based diets and chronic disease and assists in teaching nutrition and health classes for those participating in clinical studies. Susan is also an avid runner and a mother to a baby boy. Thank you so much for being here with us today, Susan.
Thanks, Cyrus and Robbie. Good to be here.
Fantastic. Okay, so let's get right into it. Many people are super concerned about, having a vegan pregnancy or being on a plant-based diet while being pregnant. Now, you're an RD and you've gone through this experience personally. So could you give us a little bit of insight here as to whether adopting a plant-based diet during pregnancy is considered safe?
Yeah, it's not only safe, it's ideal, as it would be if you weren't pregnant. Like here we know that when you eat a healthful vegan diet, you're doing yourself so many favors by reducing your risk for heart disease, cancer, diabetes, being overweight, obese. So all those benefits that you have not pregnant, you will get even if you are pregnant. So absolutely no reason to be concerned or fearful of adopting a vegan diet while pregnant. And I would say a lot of benefits that are going to come with that as well.
Awesome. So are there any special recommendations or supplementation that people need to be aware of when adopting, a plant-based diet or vegan diet while pregnant?
Yeah, yes, when you eat a vegan diet, regardless, you should be taking a B12 supplement. But when you are considering getting pregnant, your obstetrician is going to tell you right away, take a prenatal, right? That's even before conception, ideally, which will include the B12 and include all the nutrients that someone who's thinking about becoming pregnant should be getting. So certainly, and for a lot of people, they don't plan it and then they're pregnant and then they start taking the prenatal, and that's perfectly fine too. And that prenatal will cover a lot of those needs, and then stop. Arguably you don't need all those vitamins if you're eating healthfully, but being pregnant, it's a good time just to cover your bases, and a prenatal will do that for you regardless of your dietary choice, and I support that.
Got it. Okay. And how long do you recommend mothers breastfeed?
Forever. No, but I am one of those, my favorite profession in the world belongs to lactation consultants. These people are gods and goddesses to me. They personally I knew I was going to breastfeed after I had my son, but I have to say, and there's a lot of reasons for this, but the hospital, I had my son in a hospital, didn't really set me up to leave with confidence in nursing. Unfortunately, I don't know if it's just they didn't have time to spend with me. They had wonderful lactation consultants, but they're seeing lots and lots of women. I hired one, and I don't have a lot of money, but this is the best investment I ever made. I hired a lactation consultant to meet me at my house when I got home and coach me, and thank goodness and I just worship these people. So if you have to do that to understand the importance and the technical skills to breastfeed, do it, even though it's very natural and a lot of people just figure it out like that. But the World Health Organization tells us that we should breastfeed for at least 2 years, The American Academy of Pediatrics says at least 1 year, but I think that's more because it's what they think American women were willing to do, but the longer the better. If you can do it for at least 2 years, I think you're really setting up your kid for best possible outcomes for health and other things. It's associated with speech, good speaking skills, teeth growing in the proper formation and having lots of space. It's fascinating how nursing benefits a kid. It's in all different directions, including nutritionally, of course.
Yeah, there's actually this whole body of research that's now showing that kids who are not breastfed for a sufficient amount of time end up at a higher risk for developing autoimmune conditions. Type 1 diabetes being an autoimmune condition, but then there's also celiac disease, multiple sclerosis, Hashimoto's thyroiditis. And it seems like there's a lot of, there's a lot of connection, whether it's causational, whether it's associative, that not breastfeeding for a sufficient amount of time can actually set a kid up for complications later in life.
Yeah, great points. And I think that it makes total sense to me once you understand, like, if there's any one perfect food for anybody in the world, it is the mother's milk for the baby, of your species. Now, of course, a lot of people can't breastfeed. I mean, really can't. And that's so formula. Yes, absolutely. And I would pick a soy formula as opposed to a cow milk derivative, but get the formula, no shame in that. If you got to do it, I mean, that's the best thing for the kid second to breast milk.
Yeah, so on this topic here of formula, like the predominant formulas that you buy at the grocery store are cow's milk-based formulas. They contain a lot of casein, along with a whole bunch of other, vitamins and minerals to support the growth of the child. How easy is it to find a soy formula / are there any other plant-based formulas that you would recommend for mothers who choose not to breastfeed or who can't breastfeed for a sufficient amount of time?
Great question. And with my limited expertise on pediatrics, I think only soy formula is the alternative here that's manufactured and sold. And I think they're pretty commonly available because a lot of kids with sensitive guts can't do even the dairy-based formulas, and hospitals know that, and they have the soy formulas there as well. So if you can do the soy, you should do the soy for sure. You don't want to bombard. Personally, I wouldn't be comfortable giving any kind of cow milk derivative to a child when we know how sensitive children's guts are to cow milk proteins. Better safe and use the soy.
Got it. Okay, so let's fast forward now. You're a mother, you've had a plant-based pregnancy, you're feeding your kid a plant-based formula, or you've breastfed them for, let's say a year and a half. Now it comes time for, the kid's growing up, they're a toddler, or maybe they're, 5, 6, 7 years old. At that point, should mothers and or parents be concerned about, vitamin and or mineral deficiencies in young children based off of just a purely plant-based diet?
Yeah, so I think mothers, parents, guardians, they should have concerns that all parents and guardians should have for their kids. They should be eating a well-rounded diet. So lots of fruits and vegetables, whole grains, beans. These are great foods for kids, and they will cover most of their nutrient needs if eaten, if they eat that kind of a well-balanced diet. For vegan children specifically, like vegan adults, there's one supplement that you just absolutely have to have, and I wouldn't mess around with it, and that's B12. So B12 can be found in a multi, but it can also just be taken as is. So for toddlers, well, I should say for infants, if we really want to rewind and talk about some nutrients of concern, the reason why pediatricians tell you at 6 months of age, that's when you have to start feeding a kid. You still breastfeed or give formula, but you have to start giving them food. Well, why? I mean, there's probably a lot of reasons, but one of the big ones is that at 6 months, it's about the time that all of that baby's iron stores are gone. They've stored up all this iron having been in the womb. And iron doesn't leave your body easily. So slowly over the course of about 6 months, they're depleted. And that's when you have to start feeding kids. And commonly it's iron fortified this or that, iron fortified rice cereals or whatever. But it's also a good time to give them, I think, foods like mushy lentils, which are so rich in iron, beets. So you can find high iron foods other than just fortified cereals to get that kid eating lots of healthful foods and get a taste for healthful foods. So that's one. That's when the concern for iron starts with kids. And then, you know, as they age, you do want to make sure they're getting enough calories, still getting that formula or breast milk until at least one. And then as they start to grow and not nurse or use formula, yeah, you're going to have to give them a B12 supplement. And you, as the mother, if you're nursing, you have to take a B12 supplement that whole time, because that's where they're going to get their B12 as well, of course.
So regards to, you know, an overall optimal diet for a child growing up, is there any modification that need to be made? Do they need more fat? Do they need more protein? Is there any differences between, you know, an adult?
Not necessarily. I mean, people think kids need more fat, and maybe. I mean, I've heard arguments to say that kids do fine when they don't have, you know, when they have like a low fat diet, the way that's often recommended for adults. But it's fine, I think, to give kids things like nuts and avocados and those higher fat foods. Certainly, I haven't seen much evidence to say that that's not good. Of course, we don't have a whole lot of evidence with vegan diets in children, other than to say that they appear to be perfectly safe. But no, I mean, a vegan or vegetarian child technically has higher to meet our government standards for how much protein they need. It's slightly higher for vegetarian and vegan children, but it's not so high that you really need to change how you're eating, because Western diets are so jacked up with protein that all those needs are going to be covered if they're just getting an adequate amount of calories.
Phenomenal. Okay, so here's a situation that rolls around a lot. You know, I've seen it with you know, my own family members, my sisters, and their kids. So you know, you're a parent and you've decided to raise your kid as a, you know, plant-based, and your whole family's gone plant-based, and then your kids go to a birthday party, you know, or they're going to a friend's house and they're, you know, provided with barbecue or with pizza or with birthday cake. And all of a sudden now the kid's kind of looking at it, it's like, I don't know, like, you know, if I don't eat this food, then I'm going to be missing out on this experience, right? Mm-hmm. So is there some kind of, you know, for other parents that are in this situation who are trying to like make healthy decisions for their children, and their children get put in these, you know, somewhat potentially awkward situations, do you have any ideas for like how the kid might be able to handle it, or how the parent might be able to handle it?
Yeah, so I think that, you know, up to a certain age when kids don't really know what's going on, so to speak, when I take my son, who's almost 3, to a gathering, he doesn't really know that, you know, I slip out the vegan cupcake out of my pocket. He doesn't know that everybody else is eating the other cupcake. And frankly, he doesn't even care. Like, he wants to just go play. But I think, and from what I've seen, when I look at my friends who have older kids who are vegan as well, they really seem to have instilled in them the value, you know, just being honest, like, we don't eat animals. So that by the time a kid is seriously like 5, they just know. And even my son at his school will say, you know, I'm vegan. I don't eat goldfish or whatever the junk the other kids are eating. He knows he doesn't eat that. And the other kids even know, like, Henry doesn't eat goldfish. It's like, that's right. So, you know, I'm really glad that they have the vocabulary down, because I think by the time, and what I've seen from friends, is by the time they get to a certain age, they are making a conscious decision. Like, I don't eat that. They don't have to be preachy or get into it. I don't eat that because it's mean. They just, you know, I don't eat that. And then I think it's just like when I go to a gathering, bring something that you can eat. So having that alternative and bringing to share so other people can see that it looks normal, it tastes good. So the kids fit in. I mean, we all know this. We do this too. Like, we'll bring amazing dishes to functions and eat that, but also share with other people so they can see, oh, this is, you know, a little teaching moment subtly. If not teaching to eat more healthfully, just showing that eating healthfully is good. So I think that's the key, to be teaching the kid to be forthright, but respectful. And I think they get it. I don't think they go and feel hopefully ostracized, or like, oh, I really want that barbecue pulled pork sandwich. It's like, I don't think they do. I mean, I think that would, for a lot of vegan children, it's like, no, thank you. I'll just have my, veggie burger or whatever.
Great. So let's say somebody's listening to this and they're a parent, they have type 2 diabetes, and they're gonna make some changes. They're like, okay, I know about this information, I'm gonna do it. And they have some young kids, and they have a partner. Can you give some tips on how to deal with that situation? Should they force their family to come along with them? Is there a way to communicate? Like, how can you help somebody navigate that situation?
It's such a great question, because it's so real. I mean, this happens all the time. I see patients in our clinic who are diagnosed with diabetes or have diabetes but want to make a dietary change. And they're really excited, but they're nervous about their kids or their spouse. And I think I would never suggest that someone force it upon them. But oftentimes, for example, if it's the person in the house that does the cooking, it's like, I'm doing the cooking now, so this is what we're having. And I also think that because options and recipes are so widely available for eating healthfully, that the cooks in the house know how to make things taste good so that the families like it, and do eat that way in the house, and possibly even change their lifestyle to be supportive of that person who is eating a more therapeutic diet, which is great. A lot of people, that's what they want to do. They want to be supportive of their parent or their spouse. And, again, just yesterday, I had a patient with diabetes who talked about how her kids like these foods and are being very supportive and just want her to be healthier. And and then moving along the timeline a little bit, when these people start to lose weight, get healthier, feel better, more energetic, start exercising more, and you're the spouse watching that happen, it's like, wait a minute, I want that for myself too. Who doesn't want to be more fit and physically active and have more energy and spring out of bed in the morning with less aches and pains? So I think that it sells itself in many ways. Be patient. No need to force it, because the people in your life would have to be, immune to the desire to be healthy, not to follow suit just a little bit.
I love that. Leading by example is just something we talk about all the time. So
it really works, yeah.
One thing I want to address here is the concept of how, sometimes, I'll be on the phone with somebody and they're like, oh, well, my spouse or my kids, they can just get away with anything. They can just get away with it. I mean, do you have a way of addressing people who think like they're not seeing symptoms now, but they might have symptoms later? Like, how do you address people who think they're getting away with it?
Yeah, well, it's a really hard concept to push, especially with younger people who feel somewhat immortal. And there are definitely exceptions of people who get away with it, whatever it is, right? Oh, my aunt was 100 and she drank every day and smoked cigarettes. Like, yeah, but that's just not a common formula for longevity, I'm pretty sure. But, so there's going to be those outliers. But you have to think about how, and I think a lot of people think they're getting away with it if they are thin, especially in this country. It's like, but that's not it. It is what's going on the inside. And you can have someone running marathons every month who looks fantastic, drop dead. And it's because on the inside, they're eating themselves into conditions like heart disease, arterial plaque formation, too much fat in the cells, so their insulin isn't, is too resistant to doing its job. You just never know what's going on that you can't see. But statistically speaking, chances are that most of us have heart disease already. regardless of how we look on the outside. Chances are we're all got some cancerous cells inside of our bodies, and we just hope that our bodies are doing the right thing and destroying those cells in a timely fashion. But, is that a risk we all want to be taking? Don't we want to give those cancerous cells, give it a good fight and eat all those high antioxidant foods and phytochemicals that prevent cancer from taking over? I mean, I really think that with statistics, again, like, what is it? 1 in 2 women, 1 in 3 men, 1 in 3 women, 1 in 2 men will develop cancer in his or her lifetime. Like that, ooh, those are bad stats. And yeah, most of us here in this country are overweight or obese, but even if you're not, half of us adults are gonna die of heart disease. I mean, that's a preventable disease. That's pretty striking. So nobody's getting away with it, I can assure you, even regardless of, Aunt Agnes, the legend of Aunt whoever that lived to 100 smoking cigarettes. It's like, come on, common sense. Let's use a little common sense.
Yeah, actually, I think what you're saying actually just struck a chord with me because, I was diagnosed with type 1 diabetes at the age of 22. And leading up to that, I've been an athlete my whole life. Ever since I was a 3-year-old kid, I was running around breaking things. And, I all throughout my adolescence, I always thought I can get away with it. At the dinner table, I was like a human trash can. It was like whatever people didn't eat, I would just put into my mouth, right?
Right.
More meat, more cheese, more milk, more vegetables, more breads, more pastas. And it was like, I had these thoughts back in the day that I was like, is this stuff going to catch up to me? Or am I I'm a growing boy. I'm an athlete. Therefore, I can take on all this fuel and there's going to be no metabolic repercussions for it down the road. But now that I know what I know, just like you're saying, there's no, even if the consequence is not something that you can feel right now, down the road, 5, 10, 15, 20 years down the road, that may not necessarily be the case.
Right. And I think, metabolically, what are you doing? But also just emotionally, what are you doing? You're not learning anything about health or how to eat well. So you're setting this, you're making it so much harder for you at the age of 30, 40, 50, whatever, to say, okay, now I'm going to change my diet. And like, oh, this is really hard. It's like, yeah, because you've been eating like a standard American diet for a really long time. So now we got to reverse all these habits. And that's tough. I mean, that's a tough road to hoe, even if the answer is simple. Changing the, what's instilled in us, our habits, can be challenging.
Completely. So going back to what you were saying here about the fact that, 1 in 2 men or 1 in 3 women are going to develop cancer. That there's also these statistics that say that, that children, that heart disease is actually visible in most people eating the standard American diet as young as age 10.
Yeah.
Dr. Greger does a good job of sort of like hammering this home. He says, how many people in the room are greater than the age of 10, right? Everybody recognizes you have heart disease, right?
Yeah.
So, from your knowledge, from your experience, from your perspective, is that true? And are there other sort of, metabolic conditions that people, should be aware of, that start at a very young age, but necessarily don't manifest until we become, older adults?
Oh gosh. Yeah. I mean, all of the adult diseases that used to manifest in adulthood practically manifest in childhood now. As you are well aware, adult onset, early onset, no. Now it's type 1, type 2. And that's the terminology now, because kids develop type 2 diabetes, which used to be an adult onset disease decades ago. Not that long ago, probably. And also, signs of heart disease. So that can be high blood pressure, that can be elevated LDL cholesterol, like bad lipid profiles, right? So all those are in children. Doctors are prescribing statins to kids to deal with this, a bypass surgery for kids to deal with obesity and overweight issues. And, just to take it back, again, I was reading a statistic about gestational diabetes, and right now I think 7% of all pregnancies, the woman may develop gestational diabetes, but it's projected to be about 18% in the near future. And that's a pretty striking development consider it. And the reason they project that is because it's so closely linked to obesity. And as we are getting bigger and more people are getting bigger, and when they get pregnant, they're more likely to develop gestational diabetes. And we know, of course, that having a plant-based dietary eating pattern can help prevent that weight gain and help prevent gestational diabetes. But even if you do develop gestational diabetes, you are so much more likely to develop type 2 diabetes after the pregnancy as the years go on. Even if, it seems like it disappeared, it's probably going to come back and get you. So it's always a good idea to start eating a healthful diet. And in pregnancy, absolutely. And you mentioned 10 years old. I've heard research showing that kids in utero have plaque in their arteries. That's how bad our diets are. But again, the solution is not complicated. It's actually quite simple. The answer is simple. Maybe the execution is a little more complicated because you have to factor in psychology into all this. But, prevention. But even certainly, if you find yourself there are answers as well. And, the answer is a healthful, low-fat, vegan diet. Check.
I love how you referenced earlier just a little bit let's just use some common sense, use some logic, and sometimes it's just like, hey guys, let's eat healthy.
People want to know, well, where's my calcium and how many micrograms of that do I need? It's like, all right, if you really want to know, but you could just eat the plants and it'll all take care of itself. Otherwise, I guess I'm here to explain what you're doing wrong, and then give you all the numbers to show you. But, my dietitian, really? I mean, just eat. Just eat plants. Eat what you're supposed to eat, and you'll be good.
I love it. So let's switch gears a little bit here and talk about some of the metabolic research that you guys are doing at PCRM. Can you talk about some of that?
Yeah, so some of it's top secret. Just kidding. But we are actively in the middle of a research trial that's been ongoing for quite some time because it's a pretty large sample size of people. But we're looking at how low-fat vegan diets influence your metabolism. We know it leads to weight loss and all these other wonderful things like reversing diabetes symptoms, reversing heart disease, lowering your blood pressure. But we were really interested in the metabolism because we also know that there are foods, like people think carbohydrates are so bad, but actually when you eat a high carb meal, it kicks up your metabolism a little bit. So you get this after meal burn effect. We're interested in looking at that. There's even something called I think it's a second meal burn effect when if you eat beans, for example, it boosts your metabolism for the meal you're eating, but it also boosts your metabolism for meals that you eat after that, which is like, what? I mean, could beans be any better for you? I don't know. But so yeah, we're looking at metabolism, and we know we have a researcher here who has done published studies on timing of eating. So it's not just eating healthfully all day, which I encourage, and I think that's the most important thing, but it's eating earlier in the day, just kind of showing how you're when you wake up in the morning, your body is ready, and it kind of moves with the planet. As the day winds down, it gets to be evening, your body starts to wind down too, and it doesn't churn up those calories quite as quickly. So all that is kind of fascinating, and we'll see where that research goes. But just, the list of benefits to this way of eating, I need more paper because it just keeps going.
So let's go back to what you were talking about here about gestational diabetes, because I find this to be a fascinating topic as well. So you're saying that right now there's about 7% of all women who are pregnant develop gestational diabetes, and in the near
Correct.
future, that number is projected to go up to about 18%, which is between 1 in 5 and 1 in 6 pregnancies will develop gestational diabetes.
That's right. Good math skills. And I think that's based on the obesity rates in this country, but it's also based on maybe better screening as well. So getting people more health care when they're pregnant. But Yeah, I mean, that's pretty striking, right? Like that's a really
Oh,
high
absolutely.
number. Yeah, and gestational diabetes is not fun. I mean, this is it's a hormone driven diabetes, so it's not like type 1 or type 2 for that reason. Um, but it is related to weight, obviously, and it is related to your risk of developing type 2 after pregnancy. So certainly something you want to avoid. So if you can be a healthy weight before you get pregnant, that's ideal. But certainly if you get gestational, just say you're diagnosed gestational diabetes and you're like, what? I mean, because that can be really shocking to a lot of people. Um, that's a good time to think about your diet and what you're eating so you can prevent uh, bad outcomes for you and the baby later. But you can do this way of eating, the most healthful way of eating. I think it's a great time to look into it, but it does require a lot of care and attention. Anyone with gestational diabetes needs a lot of close monitoring, because this is, again, not a time to futz around with your blood sugars and experiment, like not so much. You need to monitor carb intake, which is very different than type 2, you know, in terms of how much leeway you get there. So you want to work with a dietitian for sure if you have gestational diabetes, but you can do it by eating healthful foods. And I highly recommend people do that. Just, anyone with gestational diabetes, like whatever you're eating, you just gotta be really careful and smart.
Okay, so going on the same topic here, I've talked to many pregnant women who have been diagnosed with gestational diabetes using an oral glucose tolerance test by their doctor. And they
Mm-hmm.
come to me and they say, hey, Cyrus, like, what is it that I can do to, minimize the risk for developing type 2 diabetes later, but also maximize the health for both myself and for my kid? And, the question then really becomes for you is, in that situation, if you were to come across a mother who was diagnosed with gestational diabetes, is eating a low-fat, plant-based, whole food diet, number one, is that gonna be the best way to minimize their risk for complications during the pregnancy and when they deliver? That's number one. And number two, a lot of women are nervous that if they adopt a low-fat, plant-based, whole food diet, that they're going to be starving their child of essential fatty acids required for neurological development in utero.
Mm-hmm.
Is that a valid concern? And if so, is it necessary to sort of adjust the total quantity of fat during the pregnancy?
Yeah, that's a great question. And I think that what I would do or advise is outline a healthful diet that is within the parameters of the carb load that you can take for each meal, because it's different, right? You just can't eat all you want of fruit and beans when you have gestational diabetes. It's my understanding. And I wouldn't, you do need, I would recommend eating soy products like tofu, eating hummus, things that, even things I don't normally recommend, like maybe soy yogurt, even just getting the protein and the fats in there without as many carbs. So it's quite different than what I would normally recommend for prevention, and then for not when you're not pregnant. But I do think it's not a bad idea to take EPA DHA supplement. And I think that's true even for people who don't necessarily have gestational diabetes, because these are EPA DHA supplement is the omega-3 fats already converted to the fats that provide all the benefits. You skip the whole conversion process by just eating an omega-3 supplement, and you go straight for the EPA DHA. And that's recommended a lot of times for pregnant women anyway, and it's recommended a lot of times for women who breastfeed, because it's just a good way to just get all that into the baby. So I think I would go that route: EPA DHA supplement, take your prenatal, and then eat a diet that concentrates on carb counting, unfortunately, just for this period of time, but it's important to do that.
Okay, here's one other question about gestational diabetes. Now, we hear that, if you are living with gestational diabetes, then your risk for developing type 2 diabetes postpartum goes up. Do you know the statistics? Are we talking, is it like a 5% increased risk, a 20% increased risk, an 80% increased risk? How important is this?
Yeah, I do have the statistics written down somewhere, and unfortunately I can't rattle them off with a lot of confidence, but I do know that it was incrementally over time. So like 5 years after pregnancy, you're X% more likely to develop type 2 diabetes. And at some point, I don't remember, 15, 20 years after diabetes, it was something like 100% likely or 99% likely to develop type 2. It gets pretty stark for your risk for type 2 after having gestational. I wish I could rattle off those with more confidence, but I remember thinking, like, good grief, if there were ever a wake-up call to eat more healthfully, it would be being diagnosed with gestational. What a red flag. And maybe even for some, I mean, I don't want to say this, but I've had people get diagnosed with diabetes before and consider it a blessing because they hadn't developed the complications yet, but were able to make these kinds of changes and avoid all of that. And I think that's, if you had to find a silver lining in getting a diagnosis, certainly seeing that you have gestational diabetes would be like, okay, that's it. My life is changing right now. My health is changing. As soon as I have a baby, the whole family's changing because nobody's going to go down this road.
Got it. Now, one other, I guess my last question here about gestational diabetes is you mentioned earlier that gestational diabetes is, it's a hormone-induced version of diabetes that's sort of a temporary, it's a temporary blood glucose instability.
Right.
What causes gestational diabetes? Is it just induced by a particular set of hormones or like fluctuations of hormones during pregnancy? Or is it a combination of the diet that the mother's eating on top of the fact that they're pregnant, and then that's increasing their risk for gestational?
Yeah, so my understanding is that it is completely hormone driven. However, your weight has a lot to do with what your hormones do. So if you are obese or overweight going into the pregnancy, you're more likely to have that hormone problem, if you will. It's very similar to hormone-related cancers. So yeah, breast cancer, prostate cancer, these are hormone-driven cancers, but the heavier you are, the more fat in your diet, the more fuel these hormones have to put you at higher risk for developing certain diseases. And I lump gestational diabetes into that because it is hormone driven, but I don't want to give anyone the false implication that somehow they don't have any control over developing it, because you do. If you have a healthy lifestyle and a healthy body, you're much less likely to develop it. But yeah, I mean, once you do develop it, you're probably just going to have it, and then you can make these changes and certainly make even broader changes or lifestyle changes after you've given birth.
Excellent. Okay, we've covered a lot of really good stuff today. And so one really important question I want to ask before we go is, what tips do you have for helping a parent transition their kids to a plant-based diet?
Yeah, so I think it depends on the age of the kid. The younger, the better, right? Because they don't know and they haven't developed a taste for, I'm not even gonna call it food, but products that are so high in salt, sugar, and fat that they don't know what food is. But if they start out young, eating beans and grains and vegetables, they're gonna eat beans, grains, and vegetables and not know the difference. So that's one. So it's kind of like the prevention side of things. But if you're already in it, and I wish someone had intervened in my childhood, and I don't know how they would have done it, but I think having foods that are familiar, that taste good, So you don't go from spaghetti and meatballs to, I don't know, seitan quinoa, because that might, a kid might be like, what the heck is that? But you do a marinara sauce with pasta, and you kind of, you transition them into these foods so that they say, oh, this tastes good too. You give them a taste for the food as it's meant to be. So you stop drowning it in oils and fats and salts, so that they can appreciate the taste of a bean, and when they eat fruit, it tastes sweet to them because they're not artificially jacked up on whatever jolt they get from drinking a soda, for example. So I think slowly transitioning them into it. I also think information, again, as the child gets older, information, maybe not about health, because maybe they don't care. We talked about feeling immortal as a kid. But there are things kids care about, and they get really excited about certain things, like maybe the environment. A lot of young teenagers are very into green and living green, and goodness knows this diet covers that, right? Maybe it's ethical. People love animals. So, maybe that's the angle you take. It's more of an ethical argument. So I do, again, getting older, maybe it's actually not a kid, maybe it's your spouse or a family member. Show them a documentary that seems to inspire a lot of people to make change. So maybe more of the teenage, college years. But I think you got to find that interest for your child. You can't, again, jam it down their throat. Even, a certain age where kids are rebelling, you say, do this, they're going to run the other way. So you don't want that to happen either, because it's not, this is about their health and their future. And you definitely want to instill something that sets them up for a long, healthy life. Maybe it's sports. A lot of kids who play soccer or do other sports, you can show them how this is what's going to help your game. This is going to make you a better athlete. You're going to perform better on the field or on the court or wherever. So finding that thing that your kid likes and inspires your kid, because I just, I talked before about how the list of benefits with eating this way is so long. There's just absolutely no way you're not going to find that link. Oh, my kid's really into this. That's the link, because it helps with that. And that's how I'm going to reel them in. So find it, because it's worth the time, and make an effort to cook and get your kids involved in cooking. Because I just don't think there's any way around putting a lot of priority on the food that you're eating. I can't imagine there are few things as important as what you put in your body.
Absolutely. This is, it's funny because, as an adult, you sort of get involved in the plant-based nutrition, research, and you start to read about the benefits, whether the benefits come for cardiovascular disease or hypertension or diabetes or Alzheimer's disease. And it's, over the course of time, it starts to make a lot of sense. But then, I think a lot of parents believe that kids are separate entities, and that kids follow a different set of rules, and that, I can't feed my kid the same thing that I'm eating, because if I do that, then, my kid's going to be missing out on a collection of nutrients that are necessary for development, right? But, I think what you're saying here is very important, which is that not only are they not missing out on nutrients, they're actually getting the quality of the nutrition that they're receiving, from a plant-based approach. Into reducing inflammation, reducing chronic disease risk it's not even the same ball game, right? We're talking about a completely different, form of nutrition that's actually going to set them up for not only maximum health right here and today, but also in the future, 10, 15, 20 years in the future. So,
yeah. And I always revert back to what is probably one of the most conservative health organizations in the world, of which I'm a member, the Academy of Nutrition and Dietetics. And they say these diets are not only adequate and safe for infants, pregnant women, children, everybody, but they are beneficial to them as well. And children specifically, the research showing that they consume, when they eat a plant-based diet, they consume fewer salty and sweet snacks, and they consume more fruits and vegetables, and they tend to weigh less than their plant-based eating counterparts, which is a good thing again in this country. And then beyond that, as you mentioned, it extends into their future. It doesn't just stop at 18, I'm registered to vote, no more health benefits, but those are lifelong patterns you've set there. Even if they betray you for a year and go do something crazy like eat at McDonald's, they tend to come back. They tend to come back to it because those patterns and values have been instilled in them. And I just think that that's priceless. And again, be a priority for all of us.
Absolutely. Thank you so much for your time today here, Susan. You're always,
it was fun.
I could talk to you for hours. I really do.
It's so fun. Thank you guys so much.